What's going on, everyone? Welcome to another episode of the Milwaukee Sports Performance Podcast. My name is Michael Falk. I am the founder at Kinetic Sports Medicine, and I'm joined today by two of my physical therapists on our team, Dr. Bridget Fish and Dr. Jeff Steuck. These two see almost all of our baseball players. I'm actually just realizing I don't think Bridget's been on the pod before, so she's one of our relatively newer therapists, although she's been with us for a little over 8 months now, but she was most recently minor league physical therapist in the Milwaukee Brewers organization, helping take care of the players down in the Arizona area. And then Jeff has been with us for a while now. Grew up playing baseball in the Wisconsin area, played for GRB, grew up in Kenosha, and then was a catcher at Dayton. So in addition to working with a lot of our top high school arms, one of the players that he supported last year was drafted. He also has a lot of history as an actual player growing up and dealing with the awesome spring Wisconsin weather and baseball season. So we're going to get into early season baseball. It is currently early March, so hopefully this will be very topical as the season is about to ramp up. And these two can share some of the common things that they see in baseball players. It's going to be Bridget's first full high school baseball season. She was here at the end of travel ball season. So I think it'll be a good little conversation where Jeff can share the realities of what we have to deal with the weather and the start of the season. And Bridget can maybe share some of the hey, in a perfect world, this is what we would love to see happen as we go. So I guess just to start it off, a really easy to answer topic, but what are some common trends, common things we always talk about? We see injuries early in the season. MLB, if you look at the data, so many arm injuries happen the first couple weeks of spring training. Whoever wants to jump in first, what are some common reasons for early season injuries in baseball players?
Yeah, I think one thing I tend to see a lot of is very big spikes in demand, right? And by demand, I mean just how much throwing you've been doing prior to the season starting to how much you're actually doing once you get into high school ball and practicing pretty much every day of the week. So that's one of the big things that I will see. And lots of times that just leads to elbow soreness, shoulder soreness, things that are manageable and things that could be prevented if we were able to properly manage load and increase intensities in a strategic manner.
I feel like the thing that I'm seeing now that I'm here versus being in professional baseball is it almost catches people by surprise a little bit more. By the time people get up to that level, they go through the weeds of, I have trouble during this when I build up, I have trouble with this, and kind of learn a little bit more. Versus these ones, I feel like the players that I've been seeing recently, it's like, hey, what's happening in between throwing? Where do you get sore? And it's also been interesting to see in like at the professional level, everything is so perfectly organized, like the whole staff of strength, pitching, like player development, everything's on the same page. I have some kids that are seeing a different pitching coach, different hitting coach, a fielding coach, and then they're starting their high school stuff right now, where like I lay out the week with them and I'm like, oh, so you're throwing high intensity every day this week. Okay, that seems not great. And like trying to talk through that and help them organize it because they don't have the staff organization level trying to organize it for them.
Yeah, I think that's like a huge limiting factor in the high school world sometimes. Like it's great that there's so many like good resources out there in terms of coaches, pitching coaches, fielding coaches, hitting coaches. But at the end of the day, you can just get too many cooks in the kitchen, which sometimes can be tough as a therapist because it's like we're another cook that's getting thrown into the kitchen and we're responsible for trying to make you feel the best you can. So that's where communication can be really helpful. And if you have good resources, some of the pitching coaches we work with here, they're really good at managing their throwers or their players. And so being able to kind of rely on them for some of that stuff can be helpful. And it almost takes the burden off of us of like, okay, now I don't have to fully manage your throwing plan because you're doing that with so and so. So how do we work around that to try and facilitate some type of recovery, some type of trying to make sure your arm is feeling as best as it can so that you can go and perform.
I think that's great and kind of a common thing that you guys are both seeing even at different areas. Let's maybe take a different approach at it, but that's kind of the most common thing that the common issue that the players are running into. I mean, I guess, Bridget, why don't you lay out since you were in such a controlled environment, what would your ideal build up coming into spring training? You know, the issue that I see a little bit here is there's not really spring training. There's some open gyms, goes right into tryouts, and then usually the first game theoretically is 7 to 10 days after that, pending snow being on the ground still. But what are some in the pro ball world? How would you ideally structure it?
I feel like it's a little bit of a complex question, so I'll take it more from the medical side of things, how I would perfectly structure it. We had these guys are so closely monitored. By the time that they left at the end of last season, we have strength metrics, range of motion metrics. We know maybe what they dealt with last year, what were their normal sore spots, what's new to them. And when they came in, before they even threw a ball in spring training, before they were allowed onto a field, we redid all of those metrics and we were able to catch these little warning flags where it's like, dude, that's a huge change from last year and control that a little bit more. So I think my answer lies a little bit less in like what is the perfect buildup because the perfect buildup is just progressive overload. Do a little bit more than you did last week, and it's more in what needs to slow down that perfect buildup and what could allow us to speed it up. So some of those drops in strength, limits in range of motion, wildly new range of motion are things where you just like put up that yellow flag and it's like, hey, go a little slower. Slow it down just a little bit. This is going to be a hard buildup for you this year. Or be a little bit more responsive to soreness. Maybe last year you were sore and you could throw through it during the middle of the season. It's not the middle of the season right now. You have that yellow flag waving. If you're sore, we gotta take a step back and get back to baseline before you continue progressing forward.
I think that's really interesting. I mean, Jeff, you've worked now the last 18 months and really grown and developed sort of our monitoring program. We've tried to base it off of what the big league staffs are doing. There's limitations when we're working with high school players, but what are some things that you've seen and tried to incorporate in players that maybe mimic some of those ideas in our setting?
Yeah, I think the serial testing has been huge because then we can see trends throughout like the spectrum of the year, right? Typically at this point of the year, most guys that I'm seeing right now are coming in and they're peaking at their strength values. So they're at like new best. And that happens too because these are younger players that are still developing. So there's a lot of strength gains that we can get there. But then as they start throwing through this spring, strength numbers start to decline a little bit. Range of motions might change, but when we're able to monitor them on a monthly basis, ideally we would like to be able to monitor them a little bit more frequently, like Bridget would be able to do at the professional level. But still monitoring them on like a monthly scale is helpful because we can catch some of those things where, hey, your external rotation range of motion dropped by like 10 degrees. What's going on there? Your internal is down 20. How's your shoulder feeling? And from there, we can get ahead of things before they start to snowball. And as players develop too, they start to become more comfortable with noticing some of those trends. Recently, recently discovered this within my own philosophies is giving the power to the players. All right, like what do you notice? How does this stack up with what we're seeing here? And what are going to be like some things that we can just go to versus like, here are 5 exercises, do them. And not that I did that in the first place, but it was very much like, okay, what are the numbers showing us? Like, what do I see? Okay, this is what I want you to try to do. Now it's more of like a conversation of, okay, what are some things that have been helpful in the past that you've benefited from? Okay, those are going to be some staples that we're going to keep going with. But then how do we improve those deficits as they start to come up and then changing things based on that?
No, I mean, that's why everyone always wants to know what our arm care program is, or can we buy your arm care program? It's like, well, you can buy into our arm care philosophy and like do the
Yeah.
monitoring and do all that, but I don't have a PDF I can send you until we know that. I think, my philosophy has always been, I think it was, I don't know if Mike Reinhold actually said this or if he stole it from somebody else, but his philosophy on arm care was trying to make sure that you are you every time before you touch a baseball. So if you have 180 degrees of external rotation, then I want you to have 180 degrees of external rotation every time before you go out and throw, or whatever your strength or those types of things, making sure we get you back to that baseline before that next stress to the best of our ability. I think, Jeff, you also said something interesting that if there's any parents relating to this, you can probably relate to that high school kids are really, really good communicators. They're always crystal clear on those things. Sometimes the numbers are a really good way to start a conversation. I had a young man that I had worked with for years, ever since he was an eighth grader. I think this was probably his junior year. So it was his biggest recruiting summer. And we saw him every month. He came in one time and his external rotation strength was down 30%, something like that. And started the visit off. How's everything feel? Oh, great. Good outing. Arm feels awesome. Do the measurements. Everything's like falling off a cliff. And I was like, well, really? Like, how's your arm actually feel? Like, it's like, no, it feels fine when I'm throwing, but when I'm pulling my jeans up, like it really hurts in the front of my shoulder. And I was like, huh, okay. So he like, it was a way to start the conversation. He skipped one start, he kept throwing. We remeasured the next week. Everything had bounced back to his baseline, and he went back out and competed. There's no way to look into the future and like what would have happened if he would have thrown that weekend. Who knows? But I think it's the best that we can do to try. And Chris Ahmad says keep bumpers on the players, like keep them out of the gutter, like just nudge them back in the right direction as best as we can.
That's a great way to look at it. Keep the guards up and just keep them centered. And that's where like if you can do the serial testing becomes really helpful because then you have like their baselines at certain points. You can see all that stuff and kind of track it over time.
Yeah, for sure. No, I think I don't know, I've always liked that analogy. I think, I don't know if you'd agree, Jeff, but one of the common things that we've seen historically as a big error in the early parts of the year in high school, players will typically work up to a 40 pitch bullpen and then go out and throw between 70 and 100 pitches in the first outing. I'd be curious from both of your perspective, what's your common recommendation on progression from bullpens to live ABs to then actually, getting on the bump in a game environment?
The way I always kind of looked at it is bullpens are less stressful than an actual live outing, whether it be live at bats in a game. So typically we'll kind of measure innings. So an inning for me is going to be 15 to 20 pitches, give or take. But from a bullpen standpoint, if you're at 40 pitches, that's about 2 innings worth of work. So then once we get into those like stressful situations, I always like to have it down at least one. So if we're at 40 pitches in a game, we're only throwing like 20. And then that way we can track pitches and innings and try to progress those strategically. But we know that we're controlling for some of those stresses, the higher intent pitches, the adrenaline's pumping, all those things. So typically like 1 inning less in a game than you've thrown so far in a bullpen.
I always like the similar to that, the like valley and peak methodology where like for each section, so like throwing program into bullpens, into lives, into games, like you want to reach a peak of like this is the hardest that you've been throwing during bullpens. That first live should not be more pitches, more intensity. It will be more intensity, but it shouldn't be more pitches. It shouldn't be more volume. Same thing, you build those up. That first game, if we're continuing that progression, that doesn't account for the fact that the difference between how hyped you are for a bullpen and when you get a hitter in the box, that's different. Like you're gonna lock into a little bit of competition that's going to make you throw harder and make your body work a little bit harder. You're thinking about it more because you're actually trying to be competitive. It's going to be harder no matter what. So it better not be the same or more pitches than you've already thrown.
Yeah, I think that's a really good analogy. I mean, because there's always a running joke. Our one facility that's at a indoor training gym where the pros would throw on mounds. It's cold, not in cleats. There's no hitters in the box, and everyone's domed up that their velo's not there. But is always the mind game of like, yeah, but then you're gonna get outside and it's warm. That's like another mile an hour or two. Now you're in cleats. That's another mile an hour or two. Then you throw the batter in the box. That's another mile and two. So you're at 100. Like you're definitely throwing 100. But all the jokes aside, it's like every mile an hour is. I mean, we can measure it. It's more stressful on every, there's usually a degree or two more layback, more newtons of force across the UCL. And like that does play a role in it too. How would you guys suggest players engage coaches in that conversation? Because I honestly think that this is often an area of communication. You hit it earlier that there's pitching coaches, there's club team coaches, there's high school team coaches. And I just sometimes think, they're not all talking about what is the expected number of pitches they need in their first start. And if they're doing their throwing with someone else, do they even know what that number is? So do you guys have any suggestions on how a player could go about kind of advocating for themselves and talking to all of the people involved so that they have the right progression?
Yeah,
If
that's a tough conversation sometimes because a lot of the kids we're seeing, especially at the high school level, they are a little bit younger, freshman, sophomore year. They're not fully comfortable in their role within the team. So it's really just about empowering them to take charge of yourself. Like, this is your career. I use the analogy of you're a car, right? Like a used car. If you want to get the most resale value out of it, you have to protect it. You have to limit how many miles are going to be on it. We know you're going to put miles on it, but if we can try and decrease the amount of mileage when you resell it, it's going to go for a little bit more. So I really just try to empower the athletes and tell them this is your journey and you are the one that's in charge of it. And if you ever need me to step in and be the bearer of bad news to your coach, that's part of my role as your healthcare provider, is to protect your best interest. So I always try and empower them to have that conversation themselves, because I think that is important in the long run of being able to stand up for yourself and say, no, this is my pitch limit because I've only thrown this many in bullpens. And then it can also become an educational point if we are the ones to reach out to the coaches. We can start that dialogue of, this is why we believe they should only be thrown this many pitches in a game when they've only thrown 3 innings worth of bullpens. So yeah, I like to empower the athlete.
Yeah, I love the idea of athletes becoming advocates for themselves and figuring out how to best advocate for what their needs are. I haven't been in the middle of a season yet, of a high school season yet, so I feel like I haven't run into that. But from conversations I'm having so far this year, the hesitation that I'm getting, or a little bit of the pushback, is more like, oh, I don't want to bother them. They have a plan. Like, I don't know, my coach will let me know when it's time. And I'm like, I love that that's your mentality. I love that you want to be ready. But if you go into it, as funny as it sounds, almost with the like I statements, like, hey, I want to be best prepared for the season. What is your expectation of me when we start? I want to build up to that. Like I want to be prepared for whatever you need me to do, and like get that expectation in a way that's not like, what am I gonna have to do? What what do you want me? Like, how many innings am I gonna have to go? But very much like, I'm locked in. I want this. I want the ball. I'm gonna be ready for it. And if I don't know what ready is, I might not be.
Yeah, I think that's a good advice. And I mean, ultimately, there's no right way to handle it for players, and we're at a certain time of the year. By the time this comes out, there is an element of the haze in the barn. If you've only built up to a 40 pitch bullpen so far, it's going to be very hard to get up to an 80 pitch bullpen so that you could go throw 60 pitches in a game. I just I think I always encourage people this time of year, watch the pitch counts at the spring training games. You're not seeing Garrett Cole go out there and throw 100 pitches the first game of spring training. Even through the first few months of the season, you're seeing pitch counts stay lower. Yeah, everyone wants to talk about the playoff series, the 3 days rest. They do that once a year when they build all the way up. And I think I have an opinion on this. I think it should be 40 to 50 pitches in the first outing, and you add 10% a week up through about 80, and you hold there. And then we can talk when we get into the playoffs if we need to squeeze an extra inning here or there in a big game a couple of times. I think that is, like, long term, a better plan than let's use this arm as much as we can every single game, and if it breaks, it breaks. I just don't think that's super sustainable for the long run. But if that is what's going to happen, I would highly suggest trying to get your bullpen counts as close to or slightly over what that first outing is going to be. Does it run the risk of fatigue over the course of the season? Yes, absolutely. I'm not saying it's optimal, but it is going to be better than going from 40 pitches in a bullpen to 70 or 80 pitches in your first start on a competitive mound. And that's before you count your warm-up pitches before the game and your throws in between innings. Like realistically, that's 100 plus pitches on that one game day. So just something to keep in mind for players and families that are out there and kind of getting ready for the season right now. Let's shift gears a little bit. I think the build-up stuff is super important. That's why we started there. But let's move into, we're going to start the season. Players are getting into a routine. What are some key elements for building a throwing week? I think this is maybe the other area that we see young players in particular just really not know what to do to get ready, to recover, to maintain their arm health throughout the season. So what are some key things that you guys like to look for or put into weekly schedules for players?
Jeff, correct me if I'm wrong, from what I've been seeing, again, haven't experienced the high school baseball season here yet. A lot of the high schoolers that I've been talked to, they go 2 games a week. Do you feel like that's pretty average for what you're seeing?
Yes and no, because in Wisconsin, weather is
So true.
the biggest X factor. So like, yeah, it's typically like 2 to 3 games a week on average. Now,
Mhm.
barring any like reschedules, cancellations because of weather, you can see like up to like 4, maybe 5. I think five's a little extreme sometimes, but like typically it's like 2 to 3 games a week.
Yeah, because I think especially for pitchers, if they're expected to throw like 2 games a week, I always like to think of that as 2 high intensity days a week. And even as the schedule gets messy and it flips back and forth, trying to keep 2 high intensity days a week. If you have a bunch of cancellations, it's like learning to be consistent in that routine, even in the presence of how much change is going on, and then learning what your body needs to recover between those two. So it's almost like what we were talking about before of like, okay, what range of motions are you losing? Like what's not feeling great? And then addressing those things. So one of my like biggest recommendations for high schoolers right now, because I think they're doing so much during the week, is really trying to attack the most crucial part, which is post throw to me. If you just got off the mound, you just got out of a really high intensity game, maybe you were like killing it at your at bats. You sprinted around the bases like 40 times. You're having the greatest game of your life. How do you immediately start feeling better? What range of motion are you locked out of? What maybe muscles do you need to turn back on? Because you're going to wake up the next morning with a dead arm. Like, what can we do as soon as possible to set you up into your recovery process?
Yeah, I would agree with that. I think where it becomes a little bit of like a gray area is when we start talking about two-way players, right? Guys that are expected to go out there and throw, and then the next day they're out there in the field hurling the ball across the infield, right? With those guys, it becomes a little bit bigger of a task because there are more demands on their arm than just somebody who's a PO. So in that sense too, yes, we still need to like control the high days. But then can we like find you some times where we're actually like having you do almost like nothing and recover? Because for all the high days, we need low days to match that. We need the high days to be high and the low days to be really low. So that's one thing I've gotten better at as I've worked with more two-way players is like, okay, how do we manage overall volume? Because we do know you're going to throw on the mound and you're going to be throwing in the games. So trying to find the days that we can actually recover.
Yeah.
Yeah,
I think it's
that's a
super
good
hard.
point.
And you run into these interesting things. When I was in Minneapolis, I had a pitcher that I was rehabbing his ACL injury. It was my first job out of PT school. So I was, learning as I was going and not a ton of data on pitchers and ACLs and return to the mound progressions. So I talked to the Twins physician who was in the area we had a good relationship with. And he's like, well, pitchers don't tear their ACLs. And I was like, okay, that's true, but like this pitcher played football too, and he tore his ACL, and now he's trying to get back on the mound. And you kind of run into this with, I get a lot of parents that'll be like, well, what would a big leaguer do in this situation? I'm like, well, the big leaguer wouldn't be playing second base after he just threw 7 innings. Like, that's not a thing. I guess Shohei is now changing that a little bit, but in general, it's just not a common thing at those highest levels that you have to deal with. But I think the concept of what is your routine? What is your post throw recovery? What do you do? And with the season being so flexible scheduling wise because of weather and whatnot, rather than having this is what I do on Monday, Tuesday, Wednesday, like what do you do the day before a high intensity day? What do you do on the high intensity day? What do you do on the 2 days in between or like after that? And I think if you have that routine locked down and you can just slide it depending on the day of your start, the day that your game gets moved to, and you just don't deviate from that, I think is the key element of like being able to sustain that over the course of the season.
I would agree with that. And part of that is the flexibility of it. Like, as much as we want to be locked in on a schedule and a routine, I love schedules, I love routines, but you need to be able to adapt and you need to be able to adapt on the fly. Because as you get older too, if you continue into college, like things are going to change on the fly, and you have to be able to be ready when the situation calls for it.
Yeah, for sure. And I'm not saying even the best players in the world always have great performance habits, but I think you see more players at that level that do really do the little things, the sleep, the nutrition, hydration. It matters a ton. And I can talk about it. We have more podcasts on it. We've got webinars on it. We've written blogs and social media on it. And it is that important. And I promise it is the stuff that the guy across from you isn't doing. And it's totally free, but getting to bed on time, drinking enough water, making sure you're eating enough food, ideally high quality food, but like just enough is a good starting point. It really, really does matter when you go time in and time out over the course of the season and have to serially recover ongoing. So I'd really encourage people to take advantage of those free little performance enhancers that can help with the recovery.
Absolutely. I've already talked to a couple of my high school players this season so far, where I'm like, hey, make sure you know exactly what you weigh right now, because if you get to the middle of the season and you've lost weight, that's a clear indicator that you just like aren't eating enough for the amount that you're doing. That's a number one. If you're not covering that, your body actually just doesn't have what it needs to feel better. No amount of dry needling or exercises or stretching that I give to you will be meaningful if you lose 12 pounds every season. Like that's just a tough spot to be in.
Yeah, no, I think that's for sure. Let's wrap it up here with the last one. I think another really common question that we get, issue that I see younger players struggle with in particular. Some of them have never been hurt before, and it can be really difficult early in the season to differentiate between soreness and pain. What's something that's okay to work through and sort of a normal part of getting your arm back in shape versus what is something that should be that either yellow or red flag that's popping up and saying like, hey, let's not ignore this. So what guidance would you give to players and families on how to manage soreness versus pain?
This is the age-old question.
Yeah.
Like this is always the toughest one. The general pain guidelines, whatever a PT is going to tell you is always going to be like, oh, anything over a 3 out of 10 pain is a bigger concern. And that's definitely true, but soreness can linger. So any lingering soreness, I tell people if you're pointing to it with one finger and not just this general soreness, that always concerns me a little bit more. And then if you get into a situation where you stack soreness, you're sore from the last time that you pitched a high intensity and you haven't recovered from that yet, you're like even a little bit. Like if you're not even on the downtrend at all and you've just been consistently sore, you're probably not ready to stack more soreness on top of that. Those are my general ones, but it's so specific to every person. It is the hardest thing about building up into a season.
For sure.
Yeah, I think, at least in my experience, the guys that I've seen consistently for monitoring, it's a little bit easier to have that conversation because you know how their arm tends to trend. They go throw a lot of posterior shoulder soreness, maybe some lat soreness, and that's kind of like their normal versus the player that's just now coming in and saying like, this started 2 weeks ago and it keeps happening. Like, what's going on? That's a little bit harder of a conversation because we don't quite know, right? We can go through the testing, check out where your range of motion's at, and have an educated guess as to what we might think is going on. But if we're not tracking them over time, it's a little bit more of a challenge to say like, yeah, this is normal. Let's get on top of it, or like, okay, this is a yellow or red flag. We need to be more concerned about it. So I guess my answer to that question would be get checked out regularly because that'll help in the long run of being able to manage some of those things.
Yeah, I agree completely. And I think it comes with experience. The more you do it, the more you start to learn what's normal for you. And that's one of the things that I always tell people is, for the most part, it's not anyone's first time playing baseball. So how does this feel relative to last year or the year before that? And if it's a lot different, I'm not saying that something's wrong, but I'm like a little bit more concerned. If you always get, sore in the posterior part of your shoulder, and now it's more in the front of your shoulder, and that's not something that's normal for you. Like that's, something that might be worth exploring a little bit. But, every time your arm hurts, it's not, you don't have to panic. There is an expected buildup. I think how quickly you recover from it, how quickly you bounce back, and how good it feels within 24 to 36 hours are going to be some of your best guides for how significant is it. Does it go away as you start to warm up and move, or does it actually get worse as you start warming up more and getting into it more? That's going to be a red flag. So some of those little things, but if in doubt, especially the younger you are, I'm much more conservative with those players. I've learned, and Bridget probably knows better than any of us, it's a dirty little secret that the longer you throw baseballs, like typically the worse your arm feels. You don't find very many 30-year-old pitchers that are like, yeah, my arm feels awesome most of the time when I throw. But I don't think it's, if you're an 8th grader, that's not something I'm ready to throw in the towel yet on. You've got a long career ahead of you. So I do think it also depends on age and those things. But if you are listening to this and you ever have concerns or questions, this is one of the reasons we have injury consults in our facility. We've got really talented PTs that see probably more throwing arms than anyone in the state, and are very experienced at helping people sort through that. So you're always welcome to reach out and come in and chat with them about what's going on as well. So I really appreciate your guys' time this morning and sharing your expertise. I think this will be really valuable for players and families as we go into the start of baseball season here. Bridget will get to learn a lot about Wisconsin baseball and the challenges of a spring sport outdoors up here. So that will be new and fun for her to get her feet wet this year.
Already seeing the snow outside my window right now. It's going to be crazy.
Yeah, I know for sure. And if you're listening to this and you're a baseball player, you don't feel like you have a good routine, you don't have someone monitoring your arm throughout the season, we would love to help you with that. There'll be a link in the show notes. You can reach out, talk directly with me. We can get you set up with either Bridget or Jeff to go through our monitoring program to get some of that objective data, to set that baseline for you so that we can help you dial in your routine so that you feel like yourself every time you go out and throw this season and hopefully have your best season yet. So thank you guys for the time, and thanks for everyone for listening, and we'll see you guys on the next episode.